Hello, I am Dr. Jayanta Datta. I am a consultant physician and intensivist with special interest in diabetes management. I have been practicing in Millennium Clinic as a director since last 20 years. Apart from this, I am a visiting consultant to hospitals around this locality, particularly Charnock Hospital, Uma Medical Related Institute and the Spandan Hospital. Today we are going to discuss about the symptoms of constipation, particularly the chronic constipation. A patient who presents with chronic constipation, they come with abdominal discomfort, sensation of bloating, sensation of incomplete evacuation of the bowel, excessive straining during the defecation, and lastly anorectal pain or maybe some kind of bleeding from the rectum. Various modalities of investigation of chronically constipated patients. The first investigation, of course, is the bedside clinical examination, and out of all these examinations, two examinations are very important. One is per abdominal examination to detect some kind of mass or some kind of tenderness in the abdomen, and secondly the inspection of the anorectal region to see whether there is the presence of hemorrhoids or not, or some other fistula or not. You have to find out from the anorectal examination, and you have to do digital examination of the rectum also to see whether there is impacted stool, whether there is fissure, whether there is any mass palpable in the rectum. The various warning signs and symptoms of chronic constipation. If the patient complains of bleeding per rectum, if the patient complains of painful defecation, and if he also complains of progressive weight loss and loss of appetite, then one has to keep in mind that this patient might be suffering from some kind of serious ailments. So these 3-4 symptoms are defined as a red flag sign for chronic constipation. Whenever you get this kind of patients, you have to be very, very careful about the next course of investigations. Particularly, this patient needs a ultrasonography or other imaging examination of the abdomen. If that does not solve the problem, this patient needs to go to a gastroenterologist and go for either a sigmoidoscopy or colonoscopy examination to rule out any colon cancer or other serious diseases. Thank you for watching this video. I hope this video will be of practical use to you and improve your clinical knowledge. If you want to find me, please go to careclues.com and find out.